over the last couple of weeks, we have worked with our regulator and within the sector to try and establish safe working practices. And I would like to reassure you that there's been a lot of work that's gone into coming up with the strategies to protect patient safety, safety of our staff, and to protect the safety of the wider public. It is a huge responsibility, and we can do it. As a sector, we are used to protocols for preventing infection and also risk assessments and managing situations as they arise. And this is an unprecedented situation, but robust protocols have been established. And I would just like to say to you that you will get information if you are our patient or if you are going to be our patient at any of our Create Fertility or ABC IVF clinics. And you will receive information, very clear, transparent information about our COVID-19 strategy and all the information that you will need to understand what it means having treatment during this time. And you will have an option to decide whether you'd like to proceed with treatment or whether you'd like to postpone your treatment. And you will also receive, you'll also have a consent form after having read the information. So you will need to sign the consent form. There will be a screening questionnaire you will need to fill in every time you come into the clinic. So they are very clear. They will be explained to you by our clinical team. You will have the opportunity to ask any queries, any further questions, so that you are confident that we protect you and the staff are protected. That's quite important. Everything is designed to protect you and to prevent the transmission of infection during this time. So we will be following the Public Health England guidelines. That's absolutely the basic principle for social distancing and screening as symptoms, self-isolation, all of that. That would be a constant mantra. We will be following that. And it will be a joint responsibility that we will work together in this, because that's absolutely necessary. Protecting the safety of patients, staff, the wider public, saving lives while trying to create lives would be massively important. And the entire team at Create Fertility at all our clinics have been trained, have read the information, and are ready to help you. So we have looked into 3 different sections. One is about patients, the other one is about staff, then about premises. So we have worked on reconfiguration of our premises for social distancing. We have modified our working practices, and we have set out robust protocols. So I just would like to reassure you, we are here to support, we are here to protect your safety and to ensure that your treatment can be carried out safely and responsibly by our clinical team. Thank you.
So we'll start with the first question, which you've kind of covered already, Professor Nogin, but are we resuming treatments now?
Yes, we have received the approval by a regulator on Monday, late Monday afternoon, and we will be resuming treatments. So patients are contacting us, existing patients and those who are new patients, about starting treatments, and we are able to start treatments for you. The first treatment scans, I think, are scheduled on Friday at our St. Paul's Clinic and also in Manchester. In Birmingham, I think, are scheduled from Monday. And then other clinics, we are confirming based on patients' needs. So yes, we are resuming treatments.
Thank you. And our next question is, how will you prioritise patients to begin treatment?
No, essentially, we have enough capacity as regards to premises, staff, laboratory. We are able to treat patients who are previously or existing patients, and also new patients who have come on board during the lockdown after having had virtual consultations, and they will need to. But the important thing is to make sure that absolutely everybody has read the COVID-19 patient information sheet. Once they've filled the questionnaires and signed the consent forms, they're ready to start. So it's absolutely no problem. But there are patients where we may have to consider them delaying because of a potential high risk during COVID-19, and that will be discussed on a case-by-case basis with patients. So we should be able to help. And if you think that if that question, whoever asked that question, if it is to do with NHS or self-funded, yes, everybody, both NHS patients and self-funded patients are able to start treatments.
Thank you. And the next question is, what are we doing in our clinics to ensure both patient and staff safety?
There's a lot we have done, okay? And there's been a lot of work that's gone on behind the scenes. We have worked with our regulator as well, and we will constantly be working closely with our regulator and within the sector. So as I said earlier, there has been, about premises staff and patients, screening, as well as social distancing within our premises, PPE as required, as appropriate in different areas. All of that is covered, and we will be following Public Health England guidelines strictly, and that is where the patient information and the consent comes, and patients will read that, and we are able to ensure that the patients have understood and have signed consent forms, because it is joint responsibility. We will need to work together. They will need to ensure that they follow Public Health England guidelines as well, not just in clinics. Yes, of course, we will ensure that, but in private, they should be able to follow Public Health England guidelines as well. So there's lots we have done to ensure safety. And I don't think patients should be concerned.
Thank you. And will there be restrictions on patients bringing partners into the clinic with them?
Yeah, yes, once they have read the information, they will see that we would prefer to reduce the number of people in the clinic premises, and therefore we would be asking them, if possible, to come on their own. That is very clearly stated in our information sheet. And at this point, I think I should also say that we will continue with video consultations for initial follow-ups and treatment consultations, because remember, the rule is to reduce unnecessary travel in this situation. So where it is not necessary to come into clinic, we would try and still continue with virtual appointments. That would help to reduce travel, and we will minimize appointments without compromising. And I think at CREATE, we are in a much stronger position to try and achieve that due to our protocols of natural and mild IVF, that we can reduce appointments and still deliver successful and safe treatment. So sorry about the long-winded answer, but we will try and explain that to patients.
Thank you. And that leads nicely on to our next question. So what is your advice on travelling into clinics?
Yes, I mean, depending on which clinic our patients are going to, we have car parking facilities in many of our clinics. And so they will need to decide which is the best way to travel. And those who will travel by car, which is possible for them, where there's car park, they're able to park there and then wait in their cars until they come into the clinic. So they will need to follow the guidance as well about travel.
Okay, thank you. And will scans and tests which are now older than 3 months due to COVID-19 still be valid, or do patients need to have new ones?
Yes, I mean, I have said this during our regular webinars, that if patients have had scans before the lockdown and they are still valid anyway, but those who have had scans and if we feel there's a need to open, there's a need for them to have another scan, we would of course do that without charging them extra. We would honor that. We all understand it is a difficult period.
Thank you. And what happens if any of our staff develop coronavirus symptoms during a patient's treatment? Is there a risk of cycles being cancelled?
No, we will be following absolutely Public Health England guidelines about anyone who develops symptoms, self-isolation, anyone in the family or a household developing symptoms, absolutely Public Health England guidelines. And that is not a problem because we have adequate staffing levels to continue treatments.
Okay, and will we be doing fresh transfers or just frozen?
Depending on what the patient wants. So there will be clear explanation. If they would like to postpone their transfers, we would allow them to do that. If they'd like to go ahead with fresh transfers after having read the information, they can do that. And you know, the current information from the Royal College of Obstetricians and Gynecologists based on limited experience and data available worldwide, there is no evidence that you know, women who are pregnant are more susceptible to COVID infection than the general population, and there are no data suggesting that there is an increased risk of early miscarriages or early pregnancy loss.
So, as current patients, will they be contacted by their clinic, or do they need to get in contact with us to discuss booking their treatments in?
Well, we are contacting patients, but you can contact us as well. So there's no need for you to delay. Just go ahead and contact. Camilla can give you any details if necessary. I think there's a support email address and there are telephone numbers. Our contact center is open. So please do get in touch with us. And we are also getting in touch with patients. And I think last night, the first set of questionnaires and consent forms have gone out. If you haven't, yes, no problem. I can see in the chat line about how do we contact you. Camilla, can you please let patients know. And don't worry, we will absolutely get in touch with you and we will give you the details, our email address, our contact number, so that you can contact us and there's no need for you to delay. We are absolutely fully staffed to serve you.
Okay, yep, and so I'm just writing it from the email addresses to contact. And we've had a few different patients asking about this. So they're asking about immunology treatments and people who are currently taking immunology drugs. Would you advise them to be able to start treatment?
You know, it's a very good question. And actually, since COVID-19 began, I actually have been saying, even during my regular webinars, that women shouldn't be taking immunosuppressants. Empirical immunosuppressants is what I mean, not if they have been prescribed immunosuppressants for any existing medical condition. For that, of course, they have got their consultants or GP they can get advice on, but empirical immunosuppressants given during IVF treatment is not advisable during this time, and we won't be giving any of that. We don't use intravenous immunology drugs or any of that, and our regulator has also strongly advised against that. But if you're already on immunology treatment for your medical condition where you need to be on it, please contact your GP or your consultant, because it's very important. Overall, your health, your safety come first, and that is exactly what we would be doing.
Thank you. I've just seen one or two questions in the chat. People are asking sort of when and how they'll receive the consent forms and questionnaires.
Yes. So what we have been doing is we have had some patients who already, I mean, we have had lots of patients who contacted us, and we have been emailing questionnaire and consent forms to them, but then they have a chance to read. What we have actually done is we are arranging appointments appointments, specific appointments to take you through COVID-19 screening questionnaires, Public Health England advice again, and also explain specific information sheet about IVF treatment, and get you to sign consent forms after you have understood what it means going through treatment. Because your risk can change during treatment, and accordingly we will have to risk assess, and some people may have to cancel their treatment if they develop symptoms or so. All this is clearly stated, and we will, please contact us and we will send you that, and we will arrange, we are absolutely arranging right now all these appointments so that you have that first, because don't forget, this is an additional step in treatment pathway, but this is an extremely important step. So we need to do that before we start your treatment.
So I've got a question. So after a virtual appointment, how long do you think people will have to wait before they can have treatment?
Well, the next period, whenever the period is due, but before that we need to be ready with COVID-19 information, consent, the scan done, and your specific protocol sorted out, all of that, they should be able to start with the next period. So once you see our information, you know what, all your questions are going to be answered because they're very clearly written. So in some ways, if there are still some anxieties, all the information that we have put down will answer your questions, and we are going to be there. We have actually stepped up absolutely everything, counseling, information for you, and giving you time, all these extra precautions that we need to take. We have stepped up totally, because there's never been a more responsible time for us than this one. And we've got to fight the virus together, help save lives, and also help create lives, and we are ready for it. I would like to thank all our patients and staff who have really supported us. We've received massive support and words of kindness from patients during this period. And, you know, without your support, we couldn't have achieved all of this. And with your support, we are stronger in this one. And so we can get started now. Don't forget, the extra step is COVID-19 questionnaire, making sure you fill in the screening questionnaire every time. We do risk assessments. You read the information very clearly, ask questions, sign consent, and every step of the way, we are there to guide you, help you, support you, to make sure you're safe. Thank you.